Welcome back. And the next session is Procuring for Digital Health in Western Countries and LMIC, how to improve adoption and scaling of digital health. So my next task is to introduce Tobias Silman, who is a trained biochemist and immunologist and works as a partner in McKinsey's Berlin office, where he is a member of the Health, Care and Innovation practice. The focus of his work is healthcare innovation, health tech business building, and digital transformation. Tobias leads the Global Health Tech Network, a community of 1,600 health tech CEOs, founders, and 500 friends of the health tech who are investors and corporate health tech leaders. As part of his work, Tobias co-publishes the eHealth Monitor in Germany. And we're delighted that today is the regular quarterly meeting of the Health Tech Network at the summit. So welcome to all of those who have joined us from that network. You are most welcome. I think that for us, McKinsey's are a knowledge partner of the summit. They are members of the ECH Alliance, and they're involved in the Global Health Connector Partnership work, including in green health, data and digital, health disparities / inequalities, and workforce skills. Tobias is a world-class thought leader in health tech and healthcare, and it's a privilege to hand over to him. Tobias.
Thank you, Bledin. I'm blushing here. Wonderful to be here, and great to be with the Connected Health Alliance, as well as the Digital Health Summit, as well as you, Bledin, and your colleagues. Welcome, everyone. Yeah, it's a great pleasure to host this session here together with you today, Bledin. As part of the Health Tech Network, we do these quarterly sessions where we usually talk about digital health in different shapes and forms and in different geographies. Today, we want to talk a bit about procuring digital health or partnering for digital health in both Western and low and middle income countries. And I'm delighted to have a wonderful panel and set of speakers here with me. Neil Gomes will be talking about procuring and partnering for digital health from a US health system perspective. Dave Milestone, we will be talking about it from a low and middle income perspective, talking about some of his work in Africa and with innovation ecosystems. And David Lawson will talk about the UK perspective, where he has procured and partnered for digital health, both on a Guy's and St. Thomas Hospital Trust perspective, as well as now moving into a national role. And during the panel discussion, we will then also have people from both different countries, like Mathilde, who is representing France and the city of Nice, as well as Jenny Thomas, who is talking about her perspective on the supply side of digital health, as well as Sathy, who is active in Kenya. To jump right in, we will begin with the demand side for digital health, and we will start with the US perspective from Neil, and then continue with the UK perspective with David, and then the low and middle income perspective, country perspective with Dave. So without further ado, I will hand over to you, Neil. Wonderful to have you, and the floor is yours.
Thank you very much, Tobias, and great to be here. And I firstly apologize because I'm rushing to airports right now, only because of the hurricane, and now to come down to Florida and make sure everything was okay with some friends and family and my house and such. So just getting back from that. And my prayers are with everyone who's rebuilding there, especially our healthcare infrastructure. But great to be here. There's lots of things that are, hang on. I won't get on video only because I'm traveling right now, so I apologize for that, and I hope my audio is okay. The things I wanted to focus on in this session are really partnership, and what that means to us, and how we usually, when we innovate in healthcare, we don't do it just as transactions. We really need help from our partners, our vendor partners, to do a lot more with us and get on and get on a journey that that really involves a lot of work together rather than just doing something as a mechanical thing that we do. So if we could go to the next slide, I'll just give some context. This is a little bit of my personal mission, as well as my mission as I work with organizations. I won't read through it. I think you can read it. If you could go to the next slide in the interest of time. This is a little bit of my formula, I feel, for getting things done in healthcare and in many other different types of industries, at least from a digital perspective to me. So what this really means is, I feel like in order to move forward in healthcare, we have to focus on each of these elements. You can see in the narrative below that, I feel like each of these plays a very important role, and there's to some extent a sequence to this. Give me 1 second. Hi, I'm back. So you can see the sequence. I've mentioned it over there, but I feel like each of these components, design, learning, data, and insights, are really, really important in order to move forward with not just a digital view, but also a human plus digital view, which I feel like is what the purpose really is of digital in healthcare, is to not just put technologies in, but to infuse technologies in a way that it actually improves the human experience, especially in the care side of things. If you could go to the next slide. Okay. So these slides are coming up all at once, so I apologize for that since they're PDF. But typically I would go through this, but there is I think a multi-industry view that we have to take to get to human plus digital transformation. And these are some of the things that that I felt in my career I've done that have to some extent, to me at least, formed the point of view that I presented on the previous slide, and have led to pretty good successes in the health system, the digital education journey that I have, and all of these different areas that I feel have come together to form this point of view in my mind, at least, and have delivered value, as you can see from the points on the screen. We've built large organizations on these types of foundations. We've built organizations that also delivered well on growth, and some of the metrics I'll show you later. So if we could go to the next slide, that'd be great. And these are those goals I was talking about. These are typically the business constants that we have to try and achieve, through any kind of transformation, through even the daily operation of an organization. But for a transformation part, it's very important to at least achieve the last two there: create differentiation and enable growth. Many times we get pulled into reducing costs and improving quality, of course, and that's very important too. So these things usually stay the same, whatever industry you're in, right? And digital and the human plus digital connection can help in each of these areas. If you go to the next slide. In the digital space, the things that at least we've been working on lately are access, experience, and convenience, with experience being the center of it all and focused primarily on the consumer, and this could be our patients in healthcare, this could be the caregivers, and it could also be our own staff, especially during COVID when we were putting so much pressure on that same staff, to perform. If you could go to the next slide. This great researcher from Zero Spark who once said, the best way to predict the future is to invent it. And that's really becoming what people are expecting of us, CEOs, boards, that we have to pretty much invent that future. I think go to the next slide. And most of the time, it's very hard to find people who will lead through this. And most of the time, people think, oh, well, we have to find these folks within our own organizations. But most of the time, I've found it's usually partnerships. It's not just me doing this, or it's not just a few of my team members doing this or trying to lead the change, but it's our own, it's other people within the organization. Nothing in digital is really owned by digital. It's pretty much owned by the operation side of the organization, which is being transformed in some way. And so, we have to we have to lead, but we can't just expect that it's only us who will be leading. You have to come on this journey with us too. And I've worked with so many great leaders at other organizations outside of our vendor partners that have then really pushed us to innovate, even beyond what we had thought we would innovate. So that's something we really need from you to also help lead the change. So if you go to the next slide. And as I said before, digital transformation really requires great teams, great platforms, and great partners. Very important. Okay, next slide, please. So could you switch to the next slide? And we all know this, that for us to get to this future of a consumer-focused future, we have to be consumer-focused, first of all, in our mindsets. We should be data-driven, design-centered, mobile-first, ready in multiple places, AIML, AR, VR, you name it, metaverse, IoT, digitally enabled, experience-oriented, but most importantly, team-delivered. So this is something that doesn't happen by one person or one team. It happens with multiple teams, not just across the organization, but also across our partners within the industry. It's not possible for us to do this on our own. You could go to the next slide. And then this is the key slide, I think, for everyone, that's in this conference, for me, at least from my perspective. I feel like we cannot innovate on our own. It takes not just a village, but a global village to do this. I've interacted with multiple companies in my journeys across the world. I've traveled to different locations to create partnerships. And that's what's really helped us out in our journeys across multiple industries, in my case, across multiple organizations also. But firstly, there's some principles that I follow, and I feel like if our partners could come with us on this journey, that would be great. And that's that first, we got to find the real problem. Many times we get organizations that come to us with a solution, not a problem. And many times the solutions are not founded on a real problem. They're founded on a problem that someone evidenced when they came into a healthcare system or something like that. But the real problem is like 5 layers down. So keep an open mind there. Also, we invest in practical design-enabled and data-driven innovation, not just ideas or hunches. That's something that's really important to us because we know our business, right? And we know it pretty well. And we want you to also appreciate that and come on that journey with us. And so that's what's important to us too. Be willing to pivot, by keeping an open mind about your products. Remember the jobs to be done approach by Clayton Christensen. Different people have different jobs to be done with your products sometimes. So you got to have an open mind to appreciate that and then pivot the product or pivot the service so that it delivers what we really want off of it. Doesn't mean you have to have a different product for everyone, but at least aspects of the product can change. Also, innovate frugally with a value-based mission-centric kind of approach, because that's who we are in healthcare, right? That's what we have to do. So it's important that you understand that too. We are mostly not-for-profit systems that are trying to make do on very small margins. So frugal innovation is extremely important to us. And then finally, partner with your competition even to enable, synergies to take place. Give me a second, yeah. And then, healthcare is different, so do think different too. And with that, that's for this the 2 remaining slides that I have. Give me a second. Laptop, 1 second.
So thank you to Neil, who, despite the hurricane and the flooding, dialed in to share his experiences from Jefferson Health, as well as CommonSpirit Health with us. Let's switch gears now and go to the UK, and the experiences in here from David Lawson, who has been procuring and partnering for digital health at Guy's and St. Thomas's Trust in the past, and is now moving into a national role. And he will start his presentation by talking about his digital health experiences on trust level, and then also share some of his thoughts as he moves to a national role. So thank you, David, for joining us today, and over to you.
Thank you, Tobias. And I guess the context for me is when I first joined Guy's and St. Thomas's, I think we were very much analog, and now we've gone through that journey to digital. So I'm going to give two perspectives. So the first part, I'll give a hospital perspective based on my experience at Guy's and Thomas, which is a major teaching hospital in central London. And what I'm going to speak to is just some kind of different examples of how the hospital is kind of engaged in digital health, particularly in terms of innovation, and try to explain how particularly a major teaching hospital fits in that kind of ecosystem to support digital health. And then I'll change hats. So the context is that in 2 weeks' time, I move into a new role for Department of Health and Social Care as the MedTech Director. So what I'll try and do is articulate digital health from a national perspective, and set out some of the challenges that we see, and then how we're looking to address those challenges going forward to achieve through digital health better outcomes for patients. So if I just move to the first slide. So just in terms of context, Guy's and St. Thomas's is part of a wider system, an academic health science centre called King's Health Partners. And I guess from my perspective, this very much sets up the organisation for innovation. It's about partnership with our medical school, so King's College London, which shares our campus site. And also the other context for King's Health Partners and Guy's and Thomas in particular is the population we serve. So based in South East London, we serve one of the most diverse populations. And I think in many ways, we have representation from almost every country in the world within our local population. So from a research perspective, from the ability to pilot and test different concepts, it's quite a rich kind of population base to try and test new concepts. So that's our context. And within the UK, you have a whole number of these academic health science centres around the country based around teaching hospitals and medical schools, which are very much set up to facilitate, accelerate innovation and promote innovation adoption. So that's very much the context in terms of the UK. So if I just talk about speak to some particular examples. So if I move to the next slide. This system by SIDAR was partly invented by one of our consultants, so Tom Carroll, who's a vascular surgeon at Guy's and St. Thomas's. And the way the system works is that before a patient has vascular surgery, they have a CT scan, and during the procedure, this technology overlays that CT scan in a live environment when the patient is being operated on. So overlays the previous CT scan to the patient procedure and the X-ray, and it's been described as a sat nav for surgeons. So this is an example where you've got a clinician within the hospital who has effectively helped develop a concept, which then the hospital has kind of helped support, pilot, and then promote. The second example is just two digital examples. The first one is Doctor, which is a kind of patient booking service to enable patients to book appointments and providing a kind of constant messaging service. And this is designed to reduce the risk of what's called DNAs, so do not arrive. And then the second example is called ISLA, and this is about patients who have surgery when they're discharged, for them to provide ongoing feedback in terms of if they have particular wounds in terms of healing. And this is designed to reduce the frequency of outpatient appointments. These two examples are where the hospital has acted as a kind of early adopter and helped pilot and develop the technology to then enable those companies to then scale up beyond the hospital. The third example is almost like a series of mini examples. So if you move to the next slide, this is where the hospital with the college is acting as an investor, where we formed a joint venture with the college and are actively investing in particular technologies so moving from simply being a kind of a body of an organization to kind of help invent, pilot, to actually actively invest in. So I guess from my perspective, that the key message I want to convey is that within the UK you have these academic health science centres, and they're kind of they're quite a rich kind of ecosystem for innovation, particularly around digital health, and at multiple layers. So whether that's from within the hospitals, within the institutions to invent and develop technology, whether it's acting as a test space, as an early adopter for technology, or whether it's actually investing proactively in terms of areas of interest. So that's the kind of perspective from a hospital, and particularly from a major teaching hospital, where innovation is encouraged and facilitated. So I'm going to move now quickly to my kind of national hat. I'm sorry, so I'll just to kind of emphasize those key points. I think the key word there is ecosystem in terms of supporting that translation, and there's lots of kind of good stories around digital health across the country. But if I move on now to I guess a national level, so 1 week to go. So I haven't quite started yet, so I'm kind of warming up to my new role. So just in terms of context, the MedTech Directorate was established last year, and the aim of the directorate is to provide kind of policy and strategy lead for MedTech within the UK. One of the areas that the directorate is looking at going forward is to launch a new MedTech strategy, and one of the key areas of focus is around innovation. So if I just move on to the next slide. So one of the challenges around innovation, I guess, is I can term it signposting. So from an industry perspective, the challenge we have is kind of signaling in terms of demand signaling back to industry. What are our key priorities? So what technology do we want to solve which particular problems? So that's one of the challenges that we recognize going forward in terms of signposting with clarity back to industry where the priorities are. But equally, the other challenge from a clinical perspective is also, when you look at the array of different options available, is signposting what products are most appropriate to adopt in different circumstances. So just to kind of illustrate that point, if I move to the next slide, this shows the number of startups. So apologies for the number of brands kind of listed on that slide, but this slide is just kind of illustrating the kind of explosion of companies and choice that is now available. So this is looking at the number of startups founded in Europe between 2010 and 2020. So founded in UK was 182 companies with I think about 3.5 billion euros of investment. And I think if you look at Europe, the UK is the largest home for digital startups. The challenge though is from a hospital perspective, from a system perspective, is how you make informed choices when you've got this explosion of different technologies that are available. And again, if I move to the next slide, what you see is kind of a lack of kind of data in terms of and visibility around, particularly around outcome data, to kind of make those informed assessments. So if you look at the UK, and if you look at surgical activity, we have what's known as registries, where surgical procedures are recorded, but they only cover at the moment about 20% of surgical activity. So one of the drives going forward is to increase that visibility, so that from a system perspective, we can make more informed choices against this kind of array of different emerging technologies that are becoming available. And this is also partly to try and, where appropriate, to speed up adoption. So there may be a fantastic new digital health product, a fantastic app which is able to deliver, system changing outcomes, but if we don't have the visibility and the data to evidence it, then it becomes harder to accelerate its adoption. So if I was to kind of summarize at a national level, there's a key issue around demand signaling to communicate back to industry what we need, and there's a second key area around providing clarity back to the system, back to clinical teams, hospitals, in terms of which innovation, which particular product or system is the system which we should promote to maximize impact and benefit. So if I just move to the next slide in terms of what are we doing to address this. So in June 2022, a new policy was launched, a plan for digital health and social care. And this was very much an attempt to answer that first challenge around demand signaling, and to make clear what the priorities are for, particularly for, in this context, for NHS England. So key messages around prevention, key messages around the move to personalised care, about improving experience, about transformation. So the intention here is to provide that clarity in terms of demand signaling. And at the beginning, when I talked about the MedTech Directorate, the other strategy which is due to be published later this year is a new MedTech strategy, and that strategy is intended to answer that second challenge, which is around how do we objectively evaluate and assess this array of different technologies. So putting in place systems and processes to evaluate data to make those informed choices. So I think my final slide is the next slide. So key points, I guess if I'm looking at this from both a hospital perspective and a national perspective, is this issue of the need for clear demand signaling to kind of facilitate innovation, this challenge around choice, and how do we make informed choice to enable adoption at scale. But we are moving forward to address those challenges. So I've spoken to the digital strategy. There's a new MedTech strategy as well going forward. So I'll hand back to Tobias.
Thank you, David. And I have quite a few questions for you when we move into the panel discussion, both how to behave in the trust ecosystem as well as on the national level. And for the audience, if you have questions that you would like to ask the presenters or the panelists, please submit via chat. With that, I'll hand over now to Dave Milestone to talk a bit about procuring and partnering for digital health from the perspective of low and middle income countries. So Dave has had many important and very interesting roles, not only with USAID, but also in other places where he thought about digital health, innovation ecosystems, etc. So very much looking forward to hearing from you, Dave. Over to you.
Well, thanks so much for having me, and I'll do my best to give kind of a high-level perspective around digital health in low middle-income countries. And we're lucky to be joined by Sathy, who's leading and a pioneer in digital health in their work in Kenya. So we'll do my best to get through this so we can get to the panel as well. As Tobias mentioned, I'm a senior advisor with McKinsey in its global public health practice. I also am the board chair of a program at the Aspen Institute focused on building leadership and management capacity in ministries of health across Africa. And prior to that, led health innovation at the U.S. Agency for International Development. This first slide is meant to sort of give a perspective about how challenging it is to introduce and launch new products in low and middle income countries. This sort of highlights drug, diagnostic, vaccine introduction in high income countries where traditionally and directionally, this is not precise, but directionally, it can take around 5 years to introduce and reach all intended users in high income countries. We know for many reasons in low middle income countries, this is much more challenging. This is a look at sort of past introduction of global health interventions and innovations. It often takes decades to reach even a portion of the intended users. Now, this isn't apples to apples by any means, but it's meant to give a sort of directional context of how challenging these markets are. You can jump to the next slide. And as a result, there are huge needs in low middle income countries, not just sort of deaths from lack of access to healthcare, but for the first time in the last several years, there have been more deaths in low middle income countries from poor quality healthcare. And as a result, in many of these geographies, people pay out of pocket, and on average per year, it drives about 100 million people into poverty. We also know, and COVID has played a big part in slowing progress towards achieving our health goals, from maternal mortality progress slowing down, under 5 mortality, and demand for family planning not being met. So there are huge needs, but also huge opportunities. You can jump to the next slide. And we know that illness is universal, but access to healthcare, and specifically healthcare innovation, is not. There are estimates, and this is a growing number, by the way, that by 2030, we'll have a $370 billion financing gap to achieve universal healthcare in low middle income countries. And these low middle income countries share a disproportionate burden of healthcare challenges. So for example, LMICs, and this is outside of China, by the way, are home to 90% of maternal deaths. They're home to most of the internet users in the world live in low middle income countries. And yet this is conservative estimate. These countries receive only 9% of health VC. So there's a huge opportunity to innovate and finance that innovation. You can jump to the next slide. And I think people are really excited about digital health because it addresses some of these challenges across health access, quality, and value in LMICs, and can leapfrog some of the existing infrastructure challenges in these geographies. From screening, diagnosis, and prevention, identifying the right patient earlier, to care delivery, providing more appropriate and effective therapies, and remote patient monitoring. These are huge challenges with the lack of healthcare workforce in these geographies. And a personal area where I'm excited is around value-based care opportunities. In high-income countries, we have the health infrastructure built, and that oftentimes makes it more challenging to pivot towards and test and deploy value-based care arrangements. In many of these low-middle-income countries, these health infrastructures are just being built now, so we have a chance to shape those to be more value-based oriented. But these are also have a healthy enabling environment for the adoption of digital health solutions. Most healthcare in most of these geographies is delivered through the private sector. In places like East Africa and Southeast Asia, we're seeing a growing tendency and willingness to work through telemedicine or digital doctor consultations, and this is only continuing to grow. So digital health offers a great opportunity to address some of these inherent challenges and leapfrog some of these challenges, but it's also a welcoming, enabling environment. You can jump to the next slide. And as a result, we're seeing this growth in pipeline of health innovators. There's a big opportunity to grow, but we know 8 in 10 individuals in LMICs own a mobile phone. And that number is growing, and internet usage is growing by 25% a year. As a result, these large global organizations, from my former team at USAID to the World Bank to others, recognize that they need to invest in this digital health infrastructure ecosystem to support this growth of innovation. And as a result, we're seeing an increased number of entrepreneurs addressing these needs from places like Kenya, where Sathy will speak to their work with Jacaranda Health, to M-Pharma in Ghana, to Bima in Indonesia, to Alice in Brazil. We're seeing an explosion of this innovation, but we need a lot more of it, and we need investors to support that growth. You can jump to the next. This sort of is meant to summarize it. These LMICs are home to the fastest growing healthcare markets in the world. While it's small, it is growing. There's an increase in private capital and investment in these markets. There's a positive enabling ecosystem as new business models in healthcare are being developed. And again, this growth of digital health innovators. You can jump to the next. I won't go through this in detail, but I just wanted to give one quick example. Babel, which was launched in 2016 in partnership with the government in Rwanda. And there might be Babylon folks on the phone, but I think is a great example, and they've been a pioneer in identifying ways to partner with and work in lockstep with local government and national priorities, innovating around sort of providing users at all different income quintiles in Rwanda with health information, prescriptions, video consultations, telephone consultations. And again, is I think a great example of what it takes in addition to patients, really this focus on partnership and working in support of government priorities in these countries. And I think Sathy will speak to that in a bit. You can jump to the next slide. There's a whole host of lessons that are being generated by innovators in these low middle income countries. I'll focus on 3. One is a sustainable business model. If you want to reach all of the populations, including the hardest to reach, you have to really innovate and think strategically about maybe dual market approaches where your higher income populations are subsidizing and the innovation that's needed to reach some of the hardest to reach. Partnerships, again, Babel was a great example. Jacaranda is a great example of this. All of this innovation needs to work in support of national and government priorities. And then pathways to scale. All of this innovation needs to happen locally. This supply side of developing products in high income countries and pushing them onto low income countries does not work. We know that from zillions of examples. And so developing these products locally with local partners in partnerships with national priorities is key to developing businesses and business models that are sustainable and meet people where they are. And then you can jump to the next slide. From sort of a national perspective, this is work that McKinsey did in partnership and also that previous slide with Gates Ventures. But I'll focus on a couple things that we need to do to continue to build this enabling environment in low middle income countries. Really building the capacity around leadership and governments at a national level so that we're, again, working in lockstep with local partners. Digital readiness, ensuring wide access to digital devices and connectivity. Again, partnering with local stakeholders. And then again, this idea of sort of technology, ensuring, and Sathy will I think speak to a lot of these in a minute, but really working to build this sort of data infrastructure and data interoperability from the start, so that gives a platform for innovation to happen off of. You can jump to the next one. And I think if people want to dive into some of these topics in more detail, USAID recently launched its vision for digital health in low and middle income countries. And I referenced some work that McKinsey's done with Gates Ventures, and recently published an article and paper on unlocking digital healthcare and LMICs. So I'd encourage you to check those out for more information. But with that, Tobias, I'll send it back to you.
Thank you, Dave. Both for the overview as well as the case examples. That's wonderful. Let me maybe just loop in Sathy right away and discuss some of the things that you alluded to, Dave, already. So I really appreciated that we both have the demand side here, where you've done some work in low and middle income country, and now with Sathy, welcome also the supply side in low and middle income countries. Could you maybe just quickly introduce what you are doing and what's the impact you are creating before we dive a little bit deeper, Sathy?
Yeah, happy to. So I'm the co-executive director at Jacaranda Health. We provide solutions to the government to improve quality of care for maternal and newborn health. And when we talk about solutions, many of the solutions are digitally enabled. I think the prime example is an mHealth platform called Prompts, which is for moms. They use their simple Nokia old school style phones to text message back and forth. We've reached over 2 million moms over the course of the last 3 years who are constantly asking questions about their pregnancy, getting referred to hospitals, and being followed up for their care. So essentially a LMIC version of telemedicine through text message. I think the sort of key feature I think that's important is the strong partnership with government here and establishing a model that can help us achieve sustainability as an organization, which is a different model to perhaps a private sector engagement. But happy to dive into any of those elements.
Thank you, Sathy. Yeah, it would be super, since you've been active in Kenya, having worked in that ecosystem and with government. If you could share some of your experiences, also since a lot of health tech CEOs and founders are on this call. So how the model works, right? How do you get to impact, and how do you get to scale some of the things that you've encountered along the way?
So I think, start with government, because that's your key to access. I mean, we're talking about Kenya, even though Kenya has a very healthy private sector ecosystem. Once you get out of Nairobi, you're talking about 80% of sector. So if you're establishing partnerships with the government, the knee-jerk reaction is to look at public contracting. But that is a long process, particularly for a startup to engage in. So actually what we came up with was a cost-sharing mechanism with the government. So they take on part of the operating costs of our delivering the platform. We build trust with the partner, and then that sort of is a replicable model that we've been able to scale to various districts and counties in the country. So that's helped us achieve rapid scale because neighbors talk to each other. And all of a sudden now you have the power of a fairly well-scaled platform reaching half of the moms in Kenya. And I think the sort of final piece of the puzzle is to ensure that that tech is local, because you are able to incorporate the local expertise into your business model. So for example, our entire tech team is based in Kenya, and we've used machine learning that's using local language to actually reduce our per unit operating costs or our per mother operating costs by 30%. We have a local team working on a local solution, and that's benefiting our costs and then enabling us to scale faster. So it's a pretty healthy flywheel that we have going there.
Thank you. In European countries, right, we often have a situation that electronic patient records or e-prescriptions, right, that is sort of seen as the national e-health infrastructure, and that is either, public sector hosted or public sector regulated. Can you share a little bit what's the situation that you've encountered in Kenya? What is sort of the areas of digital health that are, regulated or hosted or driven by the government, and what are the things that are up for the private sector to build and to run?
Yeah, it's a great question and a live one. We've just had our Data Protection Act come into force in country, which essentially places, modeled on GDPR, places the onus and the responsibility of protecting end user data on the data provider. So that's us in this case. The role of the government is as an intermediary to enforce, but when you start talking about public health systems, the question becomes who owns the data. And we actually, based on the guidance in the law, revert to the end user being the custodian of data. So I think what we're going to see in the future is client data being hosted and owned by the client. So a home record from the client, this is my information. And then public health data, so your EMR on a government hospital system. And I think the big question is how do we integrate and create interoperability for functioning and well-streamlined system. I don't have an answer for that. Be really interesting to sort out in the next couple of years.
Yeah, thank you, Sathy. And I'm not sure whether it's technically possible to also sort of loop in Dave again. But Dave, you mentioned a few times, right, the word ecosystem and how it's important to then build an architecture, right, or set up an architecture that actually can scale in low and middle income countries. But when you look at the work that Sathy is doing in Kenya and some of the things that you've seen with USAID, right, how would you sort of architect innovation ecosystems in low and middle income countries, right, to achieve scale?
Yeah, well, I think we're just at the beginning of this, so we're in some ways building the ship as we sail it. First, I think as Sathy said, the national governments need to be at the center of these ecosystems, driving the priorities, identifying the local needs, creating the enabling environment. As I mentioned in my sort of slides, there's a dearth of private investment in health innovation in low and middle income countries. It's growing fast, but it's growing from a very small number. And so I think that there's a real opportunity for development finance institutions to create new blended finance. Traditionally these have been funded with donor funds, but the problem is when donor funding goes away, oftentimes the programs go away. And so thinking about development finance institutions, whether it be the U.S. Development Finance Corporation here in Washington, to create blended finance opportunities to crowd in private investment and blending that with sort of debt or grant funding to create these more sustainable growing businesses. So you need all these actors at the table, but I think the biggest key again is having national governments at the center of these ecosystems and crowding in sort of new non-traditional partners in health. There's a big push now in the development sector around this term localization. So there's I think a huge opportunity to, as Sathy talked about with Jacaranda, all their development is done locally, to begin investing in people in this local capacity to kind of in the development space invest in ways that will inevitably leave us out of jobs in the development space. And so I think that there's a real opportunity to invest more in people and that capacity than necessarily in programs.
Thank you very much, Dave. And I think they are, oh wow, now it's the three of us. So in that respect, right, what I've seen a few times, right, is that then sort of incubators or accelerators are being set up to support some of those programs, right? But you mentioned already the critical role of finance, the critical role of government. But how do you see it operationally happening also that this talent that you alluded to, right, and the people come in? Is there then a need where you would say let's say the donor organization and the government or the financiers, right, almost need to build sort of a business model for that ecosystem, right, so that it then can actually sort of exist for the medium to long term after the program is over? Or how do you see some of those things being resolved?
Yeah, I mean, I'd love Sathy's take on this, but I would just say, you know, there's been more talk than action around things like innovative finance. When I was at USAID, we launched the first ever development impact bond in health, and this was a way to crowd in sort of new funders, offset some of that risk. This was a development impact bond in Rajasthan, India. But I think these new sort of pay for results, outcome-based payment models from the development sector offer a huge potential to incentivize innovation in digital health. I think it's again a growing space that gets more talk than action at this point. But I think, you know, there's this growing sense of appreciation that this is a key unlock. And I think there's a lot of work, like the Financing Alliance for Health, for example, is working with ministries of health on building their capacity around innovative finance and developing new financing tools. But Sathy, I'd love for your perspective on that as well.
Yeah, I mean, I totally agree, Dave. I think one thing I would add is building the literacy and capacity around sort of the structure of investment in digital from a government health manager perspective. Just to give an example, when we talk about digital health with like a county administrator and say, can you incorporate this, you know, text messaging platform into your budget? They say, if I put airtime in, right, if I buy airtime with my budget, that's an audit query because it looks like we're making phone calls, right? We need to move from there to this is a viable investment in the same vein as paying for training or paying for transport. Paying for a digital tool is an acceptable way of delivering health services to your population. And I think that's a key unlocking factor that enables people to use their money wisely in terms of purchasing services that can deliver for their populations. We're not quite there yet. And I think this is a role where institutions can play, you know, could provide a great deal of help in capacity building.
Thank you. And Dave, you mentioned development impact bonds, right? There's talk about social impact bonds and new instruments. What's your sense about the level of openness of the investor community, right? To sort of crowd in, as you mentioned a little bit earlier. Is there something that you see already, or is there something where one needs to get the investment community together to then pretty much combine, right, government funding plus development or sort of donor funding, as well as then a crowd in the more, let's say, SDG or social impact oriented investor community?
No, absolutely. I think it is a growing space, and as Sathy said, a role that I think some of these global institutions can play in de-risking some of this. I know I have the scars to prove it from our impact bond in India. There's a huge upfront cost to developing these. From the legal perspectives to bringing people along, things move at the speed of trust in global health. And so we need more evidence that these are in fact, that the juice is worth the squeeze, so to speak, on these. But there is a lot of work across all donor organizations, from the IFC to USAID to the development finance institutions, a growing appreciation for these. And so, yeah, setting up foundational infrastructure that helps to facilitate this, I think is an important step there. But it also takes sort of pioneers from the investment community to test with us, to experiment. There's huge potential here, but like with any innovation, whether it be a digital innovation or a financial instrument, it takes testing, partnership, iteration, and I think that's a role that some of these institutions are beginning to play more of a role around.
Tobias, if I could add 2 points maybe. The first is setting the bar lower. We often talk about impact being at the level of health outcomes. I think we need to look for intermediate outputs as sort of the way to accelerate this. For example, increasing collection of revenue at a facility. That can have massive impacts at a facility and can be done with digital tools and can actually get us, further along in terms of the impact question. I think also shifting investor mindset in business models is important, and educating so that we move when we talk digital, we're often talking about a per user revenue, per end user revenue, to a more complex scenario involved, particularly in LMICs. I mean, no scale model will work if you're charging a mother in a village for it. And we just need to move away. Complex models is probably where these coalitions can come together.
Thank you, Sathy. And I guess, Dave, since you've seen many initiatives in low and middle income countries, what were some of the factors that set apart the more successful ones from the less successful ones?
Well, I hate to keep harping on this, but those who have invested time in building their local relationships and partnerships, one starting with the local need. That sounds obvious, but understanding the priorities and building that long-term trust and relationship with governments, but also local partners. The path to sort of return and viability and sustainability is longer in these markets. I showed some of those charts comparing US drug launches to LMICs. We need more patience in some of these places. So oftentimes, investors, VC folks in the US are looking for 8-year exits, and in LMICs where it's probably closer to 12. And so there is some more patience that's required. And yeah, then I think, Jacaranda is a great example of this. It's building that local team and local capacity to expand both nationally, but also look for export opportunities as well. So I think those are some of the keys that I've seen. But again, it requires not necessarily, I think someone had commented earlier, not necessarily relying on the government to do the innovation, but the private sector innovating around the needs and priorities of the government is I think how we need to think about it. This supply side innovation, we ran a number of grand challenges at USAID, which was focused on catalyzing new innovations and new approaches to longstanding global health issues. But if they're not grounded in these national priorities with local partners, bringing solutions to the doorstep of a national government is not the way that it's going to reach scale.
Thank you. And Sathy, would love to hear, since a lot of health tech CEOs and founders are on the call now, would love to hear a bit your advice to some of them, right? If they have the opportunity to do something in low and middle income countries, what would be the advice that you give to them?
Yeah, it's probably the common theme emerging is understand your path to scale, and local scale pathways involve government, not necessarily as the key partner, but as a critical partner. I think be flexible with business model. I think what may have worked in the higher income country may not necessarily work in the lower middle income country. I think Babel's actually a fantastic example of business model iteration going straight to the government for this. And then finally, just as Dave mentioned, true local boots on the ground. You can build out your tech team. There's likely opportunities for cross-pollination across borders there. You could potentially look at tech teams based in the country, then supporting your teams in various other countries as a sort of benefit from expansion to new countries. Alternatively, look at local strategic partners who are actually developing and deploying, and think about what the strategy there is. What do you bring to the table that they don't already have? Pretty sort of basic business advice, but I think even more critical in the context that we work in.
Thank you, Sathy, and thank you, Dave. With that, I'd like to switch gears a little bit back to Europe, and I'm very happy that Mathilde Demory from Nice joined us today to bring a bit the demand perspective from both France as well as a city there. So welcome, Mathilde. Wonderful to have you here today.
Thank you very much, and thanks everyone for being here today. Maybe a few words on Nice, because of course in France everyone knows Nice, but we are the 5th city in France, and we have a third of the population who is more than 60 years old. So it's pretty special in terms of demographic, because we are pretty we have a lot of seniors in this, and most of them are in shape, and a few of them needs to have special care. So it's a specificity in France. We have a strong politic on smart city, and the maybe some opportunities on digital health, because we really try to make a change on a daily basis for the citizens. Of course, as many countries, we had to manage some crises, so we had a few challenges to work on during the past 3 years about. So between COVID and we are one of the 3 cities that we are taking in charge some people from Ukraine in France, so with Paris and Strasbourg. And of course, this summer we had monkeypox, so we had a lot of challenges in terms of classical public health challenges on vaccination, etc., etc. But digital health came into the game, especially during COVID crisis, because we had to vaccine those people, and we had to, of course, invent some digital support just to facilitate the access to vaccination. Maybe a few words on our priorities that are given by the Miss Mayor. We work a lot, of course, on aging, including classical topics, and of course, including digital support. So we work a lot on mobility, on accessibility, especially for people who have neurodegenerative and neuroevolutive diseases. So we have a lot of patients, and we really work with the patients at the hospital with their doctor to try to make a change on a daily basis through digital and through innovative solutions. We have a strong expertise on cancer, so of course we have a lot of seniors, so we have some patients with cancer, so we have tried to develop some prevention programs on cancer for those people with the hospital. Chronic disease, and especially type 2 diabetes, is a priority for us, because we have a lot of patients suffering from diabetes, especially seniors. And caregivers is also another priority for us, because it comes to workers, caregivers, it comes to seniors caregivers, and so for the Miss Mayor, it's another priority, because we really try to facilitate as much as we can, of course, the daily life. In terms of institution and in terms of procurement, just to let you know, I've been working for the Nice University Hospital for the past 2 years. So the idea of this presentation is also maybe to have a focus on hospitals' steps to get into the market. As I was saying, we have a focus on patients' expectation, of course, and on clinical expectations. So there is a global market for the hospital in France, which is UniHA, and I put the website because it's the classical process to get access to digital health opportunities for the companies and for the startups. So the hospitals in France work a lot with this platform called UniHA. And for the city, we maybe we don't have on a daily basis some digital health opportunities, but we really work with the companies and the startups at a local and at a national level who wants to do some evaluation, experimentation in the city. And we try to be like a smart city demonstrator. And at the city level, it's really easy to try to experiment those product, solutions, and services. And people and the citizens are really keen on giving the opportunity to have access to those evaluation and experimentation, because for them it's really easy, and for us as a city with those citizens, it's really easy to give access to the company to have access to the citizens. So maybe in a few words, that's what I wanted to share with you.
Thank you very much, Mathilde, and wonderful to see what you are doing in these. Can you maybe share a little bit in terms of health tech and digital health? What are the things that Nice as a city is trying to put in place, right? And where are the things that, for example, are put in place on a national level? How does the split between city level and national level work for you?
Well, at a local level, of course, I was seeing Mr. Lawson showing some website on classical appointment. Sorry. So of course we do have this kind of appointments websites and stuff like that. So I mean, we have a classical process right now for those things. We try to focus a lot of. Just to give you an example, we have a lot of cameras in the city, and for people with neuroevolutive disease, we work a lot with the police and the patients association to try to be able to find those people if they have an issue, and to work with the hospital police system. And it comes to digital health, digital application, because of course the police has the big overview, but the patients association, the caregivers, they need to have those digital tools. And right now we are not at this step yet. When it comes also to digital health, we have a real challenges in terms of finding doctors in the city. Of course, at the hospital, you have access to doctors, but right now we are developing a tool giving access to doctors. It's a really classical teleconsultation, but we need to have this step because we have a lot of we have a lot of seniors who are more than 100 years old, for example, and they are home, and some of them are alone. So we need to have a strong access and strong tools to give to them, and so it's another priority for us.
Thank you. Since there are quite a few health tech CEOs and founders on this call, right, who are either already operating in France or are considering operating in France, what would be the advice that you would give to health tech CEOs how to work together in France, and maybe on a city level or on a hospital level that you've mentioned before?
When it comes to digital health, we work a lot with the hospital. So, for example, we are currently developing some robotic, surgical robotic. We are not doing that, but the clinical expert wants to develop that. So they present as a company, and they present the progress it could make for the citizens. So I think the clinical expertise for us and the clinical credit the local doctors can offer, it's important for us. So it really comes to a three-part market. It's between the hospital, the city, and the companies who wants to develop some stuff. And we now also have some financial opportunities, because at the national level for us, the ARS, the health regional agencies are really focusing on developing innovative projects. So it's easier than before to get access to financial opportunities for the companies.
Thank you. And how do you see sort of the future of, let's say, health and well-being and digital health within a municipality such as Nice, right? How do you see the role of, let's say, the city administration evolving? How do you see the role of hospitals evolving, right? What would be your vision of you know, maybe a more integrated set of services for health and well-being in the future?
Yeah, the dream would be, of course, to integrate all those words, because even if we try to have a better coordination, we have still some like 2 or 3 different speeds for the citizens who know the ecosystem, who don't know the ecosystem, and who don't have access to anything. So for us, it's a challenge, you know, to make some equities through digital health, and we know that digital can help to give equities to the citizens. So of course, integration of solutions, and the challenge would be, of course, to have public and a generic solution, because right now everyone is developing his own applications, the clinic, the hospital, and so it's kind of difficult for the population to understand how it's you know, they have access to all those applications. So for us, it's integration and simplicity, I would say.
Yeah, and well, convenience. I think, if I remember the Niels presentation from the beginning, since there are also lots of people in the audience who have very specific digital health products and services, could you maybe say a little bit about what are some of the, you know, services or use cases that the city of Nice might be interested for the coming years, or also the hospital that you've involved in, right, as part of their digital transformation, is interested in their journey for the coming years, right? Is it more about, you know, patient portals, right, and giving better access, or is it more about digital surgery or discharge management or management of certain chronic diseases going forward?
As I was saying, we have a chronic disease programs to elaborate. So we have a lot of teenagers with obesity. We have a lot of patients with type 2 diabetes. We are not really doing the job, I would say, in terms of prevention and in terms of what we would have to do. Of course, we have a patients association doing physical activity, nutrition, and all that we know, but it's not personalized yet on a digital level, I mean. And patients discharge is another issue. As I was saying, we have a lot of, we don't have many places available at the hospital right now. So we have many patients coming from the hospital to their home, and coordination is not great yet. So, like, for example, concretely this summer, we had very high temperature, and we had a lot of seniors, their kids were on vacation, and so we had to do a partnerships between SOS Médecins, which is like the emergency doctor in Nice, and the social services, so that as soon as we had a pretty touchy situation, we had to go to their home and just to see what's going on and to avoid them to go to the hospital again. So this is not digitalized yet at all. So that would be another challenge for us.
Thank you for looking ahead there and sharing that with us, Mathilde. Great to see how increasingly municipalities are becoming active in terms of health and well-being, and creating integrated services.
Thank you. It's funny that you say that, because of course it's not our role, but when you work in a city, it's like real life. So just people call you and say, okay, we have a problem, so we need to resolve it. And of course it would be a national mission, but we just have we are on the situation. So yeah, thanks a lot.
Thank you, Mathilde. With that, for the last 15 minutes of our session, I'd like to cross the channel again and go back to the UK to David and also to Jenny, who has joined us. You know, David, before you mentioned right, how to behave in that ecosystem, right? That this academic or NHS trusts represent. Could you share maybe a little bit about sort of your learnings? What did some digital health companies do well in that respect? What are some of the success factors to be in your experience creating impact in the UK on trust level?
I probably the first thing would be to echo something that Sathy said earlier around understanding path to scale. I think that's quite a key point for whatever market you are in terms of health systems, because of the complexity, but understanding path to scale is probably a key message, I think. So I guess, and I think if you look at the UK, and I imagine there's probably similarities in other countries, is that there are lots of examples of great innovation which hasn't been adopted at scale. So it's a great product, has great outcomes, but for whatever reason, it struggled to have adoption at scale. So there's something about trying to understand within each country what are the kind of barriers to adoption. I guess from my perspective, one of them will be around trying to get the evidence base, the data to kind of articulate the benefit of your product, your system, over and above other examples. And I guess the context here is the sheer range of choice as well. So how are you going to elevate your particular solution in some cases quite congested markets? So there's something about trying to think about scale. There's also something probably just around understanding kind of options around different commercial models. And I guess in my time in the hospital, I've come across great innovation developed by clinicians and you know, people with some great ideas, but they're expert on the particular product, but they're not necessarily an expert in terms of commercial modeling and how to sell the product and what different commercial models would be successful. And so sometimes what we've found is that we've had to help or suppliers kind of develop a commercial model that is workable in the context of the system we operate. So, for example, currently within the NHS, there's greater constraint on capital. So therefore, the commercial models have to lean more into more of a revenue-based model, for example. When you're looking at digital health, there's different ways that you can commercialize kind of license agreements. Is it a license per individual or is it an enterprise license and so forth? So I've seen lots of examples where great ideas, great products have been stuck in a kind of cycle because they haven't been able to work through what's the most effective kind of commercial model. I guess in the UK, there are support networks out there. So I guess AHSNs, Academic Health Science Networks, are there designed to help provide support to innovators. So if you're thinking of looking at the UK as the market, I'd encourage you to kind of approach the ASN network. In London, in South London, you've got the Health Innovation Network that provides that kind of initial interface, and they can be helpful for you to navigate what can be quite complex areas. So I guess, yeah, understanding path to scale is a really key point. There's some basic kind of business practice around just understanding your market, understanding the need, but there is support out there. So use that support. You know, you use the AHSNs, you use the teaching hospitals with their innovation units, and to get an understanding of the market and how to progress.
Thank you, and that feels like a perfect handover to Jenny. Wonderful to have you, Jenny. You know, you have a massive amount of experience about digital health in the UK. You've been part of Digital Health London. Can you share maybe a little bit what's there, right, and how companies and health tech companies that might be interested in entering the UK market, what do they find there, right, and what are some of the experiences that you've made, how companies can enter the UK market maybe more successfully than others?
Sure, thanks so much. Great to be part of the panel. David and I worked together 8 years ago at Guy's and St Thomas's to adopt doctor there. So we have a long history of experience, and as well as you said, leading the accelerator at Digital Health London. I mean, where to start, I guess, is the question there. I think that listening to what everyone has said, there's so many similar threads here in any geography that you go to. I mean, the key thing first, of course, is always to understand the problem really well and make sure that your product and value proposition is tweaked to that product, to that problem, and really spend that time engaging and listening. That's kind of always been my key kind of takeaway. You have to get all the hygiene factors right. You have to get the regulation, the information governance, to consider the integrations, all of those things. I think more recently, the key thing that's important is the evidence, because you need to differentiate yourself from your competitors, and because if you want to be adopted at scale, I think the path to scale is about evidence, and it's increasingly about consolidation of the market, because you can't sell a point solution in a market that's becoming increasingly crowded. You know, organizations, I think, are increasingly working together in the NHS, and actually, if you're going to sell something to an ICS, then you need to solve the full pathway problem. And so startups coming together, it might be 2 or 3, I think it is really useful. A key thing is always about how you support staff within a system. So at Digital Health London, we had a fellowship where we supported staff to adopt digital health solutions, and finding those people within, I think, any health system, whether that's the UK or you know, any country, is so important, because you need to find those champions and those advocates that will tell others about what you're doing and will help you to scale.
Thank you, Jenny. You know, both you and David just mentioned the word evidence, right? What is your view there about the evidence that the stakeholders in the NHS are looking for, right? Are they looking for cost of care related evidence, patient clinical outcomes, engagement scores, or all of the above? What's your experience there?
So I think it slightly depends on who you're speaking to. That's why you've got to understand the problem. You've got to understand who the buyer is. I think the one that, you know, unfortunately does come first is about cost effectiveness, because one of the barriers to adoption is the business case, being able to afford the solution. And yes, you might have a problem. It might be a waiting list problem. It might be a safety issue that is more important than, you know, the expense, or that there's more willingness to spend without the evidence. But I think if you can demonstrate that what you're doing saves money, or it solves a real kind of critical issue, then that is absolutely key. Of course, there is evidence that is required, and there are standards in the UK. The NICE Digital Health Evidence Standards. There's also the DTAC standards. So it depends which kind of way you look at it, but some of it you need just to kind of get through the door, because you have to have that. And then in terms of actually getting a purchase decision and being able to scale that up, it's about having the evidence that your product works and achieves cost savings, or it does improve outcomes, or it does solve the problem that your customer needs to be solved.
Just to echo what Jenny has said, I mean, I've spent 20 years being the grumpy procurement director, who's often seen as a barrier, and then I have to persuade an even grumpier finance director to fund these type of innovations. So normally these products are an investment. So they're not normally replacing something, they're an investment, so they're a new cost. So I guess it's trying to monetize the efficiency benefit of what this product or system will do to justify that investment. So I think if you see it as an investment decision, so a hospital or a system, integrated care system, are being asked to make an investment decision, it's been able to articulate what are the benefits to justify that investment to add this additional product, this additional system, because normally it's not removing something, it's adding something to deliver a benefit.
And there was just thank you, David. There was just a question from the audience about data interoperability and data standards in the UK. How do you see that area?
It's a massive issue, and I guess its experience has seen as that as being a potential barrier. And I guess when I spoke earlier, I referenced the new policy paper on digital health that was published in June. And if you look at that strategy, one of the key themes is around interoperability and an expectation of interoperability and an expectation around data sharing, because if you don't have that, then there's a real risk that you create barriers. So in terms of demand signaling, the demand signal from the UK is an expectation around interoperability and recognizing the value of data as well.
Thank you. I think maybe my last question now, before we wrap up, right? You know, the NHS is that, let's say, quite complex organization overall, right? And you can actually be active on a trust level, right? But then often the question becomes, how do you actually scale beyond the individual trust where you've shown great impact? What would be your advice, David and Jenny?
So, I mean, I think there's a variety of different mechanisms. There are some mechanisms that are there that are created by government. So whether they're kind of, you know, accelerators like NHS Innovation Accelerator or Digital Health London, or funds like the Unified Tech Funds or other grants. There are the AHSNs that David mentioned. So if there's a solution in one particular patch, say South London, as David was talking about, that's you know, really going great guns, then actually that AHSN can help that company talk to other AHSNs. I think the thing that actually though makes the biggest difference of all is the organization that you're working in and the individuals whose problems that you've solved, that they're your advocates and they're talking to their peers elsewhere, because that's where the trust will be strongest. I don't know which one is kind of fastest, but I think in terms of like the strength of, you know, someone, say a Guy's and St Thomas's talking to someone at the Christie is going to be pretty effective in terms of helping with that scale up. And the more advocates you've got and the more organizations, then the more effective I think that's going to be. But David, what are your thoughts?
I would agree with that in terms of it's on those relationships and those networks. I guess the only thing I'd say is that sooner or later, there's going to be more of a data-driven approach to it. So I think sooner or later, at a national level, systems will be put in place to kind of capture and identify those systems and devices that are delivering a disproportionate better outcome. So I don't think that's quite there yet, but I think it's coming. I think that's coming. So going forward, data and being able to measure and report on the benefits of your products will become more and more important. But certainly for now, relationships, champions is definitely key.
Thank you, Jenny and David. I think with that, we are handing over back to you, Bledin, on time, if I'm right here. So thanks for having us, and have a great continuation of your summit.
Nice, thank you very much, and thank you to the panel. We'll have a quick little break as we switch to the next session. Thank you both. Thank you all.
Thank you.